Alrighty, ladies and gents, let's talk about the central nervous system. First thing you need to know about the central nervous system is that it lies in the dorsal cavity of the body. So we have two cavities of the body. We have a ventral and a dorsal. Now, our ventral body cavity includes the thoracic cavity that you can see here and the abdominal pelvic cavity that you can see here. Now, the central nervous system, as we said, lies in the dorsal cavity, and this is extremely functional and adaptive, and the reason for that is that this dorsal cavity lies in bony protection. So the dorsal body cavity is subdivided into two areas: the cranial cavity, which of course holds the brain and most of the brainstem, and the vertebral cavity, which is made up of a vertebral column that you can see here. And the spinal cord occupies the vertebral cavity in the vertebral canal of the vertebral column. A lot of technical terms there, hope you got that. Right, let's move on. So if we actually dissect away the bones of that cranial cavity and spinal cavity, vertebral cavity, this is what you see. You'll see the brain. We can't see the brainstem because that's actually hidden behind the parts of the skull that have been left there, the cranium. And we can see the spinal cord that's going to extend down to about here. And we have had to remove a lot of articulating bone in order to actually see these. Remember that the texture of neural tissue is about a marshmallow. And so these bony encasings help to protect it. Why? Because we have to move. And so there's movement in the spinal joints. There is, of course, movement in the brain. And without a skull to protect our brain, then we wouldn't be doing things like playing contact sports, for instance, because everyone would run the risk of being paralyzed during their first tackle. So let's move on. Let's talk a little bit about the brain. And we're going to start by looking again and reviewing the difference between grey and white matter. Now, we said before that the grey matter is comprised of cell bodies, dendrites, and synapses. And now that we've discussed the neuron in full, I'm going to add one more item onto your list of things in grey matter, and that's unmyelinated axons. So axons without the myelin sheath. And these, the axons usually belong to very short interneurons. So they're very short and they're purely to communicate between two neurons. Now, the functional reason we have grey matter is because they are integrating centres. So they receive the information and they decide what to do with it. Conversely, white matter, which as you know consists of only myelinated axons, is going to carry information between sites of grey matter in the central nervous system. So you can really think of white matter as information superhighways. And you may think I'm using a bit of hyperbole there, and that's probably fair enough. But consider this, that the thickest myelinated axons in the nervous system can actually carry information of speeds of up to about 100 meters per second. And so if I can do this rough calculation, that equates to around about 400 kilometers an hour. Apologies if I've got my maths wrong, but it's a hell of a quick speed to be able to carry information. So it really is. I think that's a reasonable statement to make. That is like an information superhighway. Of course, as we go caudally through the cranial cavity, we'll find the brainstem. And we already know that we've got several structures coming off the brainstem, and you can see those here, and you can see those here as well. And they're called the cranial nerves. Again, the cranial nerves, even though they come off the brainstem, they are considered as part of the peripheral nervous system. And in fact, they share a lot of anatomical characteristics when you go down to a microscopic level with neurons of the peripheral nervous system as well. So the cranial nerves, even though they're in the cranium, they are part of the peripheral nerve system. I hope that's clear. Cool, let's move on. And we're going to look at the spinal cord. So what you can see is that the spinal cord starts superiorly around this area of the skull. And this area of the skull is called the foramen magnum. Foramen just means hole, and magnum just means large. So it's a large hole. And this is the demarcation between the brainstem that you can see here and the spinal cord that you can see here. So it starts cranially, so in other words superiorly, at the foramen magnum, and it ends somewhere in between the lumbar vertebra L1 and L2. But there's a couple of different growth features that we can see here. We can see two enlargements. One's called a cervical enlargement and one's called a lumbosacral enlargement. And if you've done any kind of anatomy before, you'll probably be thinking, well, hang on a minute, Morgan. I know a little bit about the lumbosacral regions, and the lumbosacral region of the spine is down here, and that's correct. The reason we call this the lumbosacral enlargement up here is because the spinal cord forms in utero, and the lumbosacral region of the spine would have been here in utero. However, what happens as our bones start to develop and grow, then our vertebral column extends cranially and caudally, but our spinal cord stays roughly the same length. It doesn't elongate with our vertebral column. So what happens is that the lumbosacral part of the spinal cord gets left down here, but the bones of the lumbosacral junction grow and are down here. So hopefully that explains why this is the terminology we use. Now the question you might be thinking is, why is there an enlargement there? And that's a good question. And the reason is that in regard to the cervical enlargement, the nerves to the upper limb come from the region of the cervical enlargement. This means there's lots of sensory information from the upper limb going towards that area of the spinal cord, and there's a lot of motor information that needs to be going out towards the upper limb from that area of the spinal cord. Now, in order to house all of the cell bodies and the tracks for all of that information, we need to have a larger structure, and that's why we have the cervical enlargement. Now with the lumbosacral enlargement, it's the same deal, except now the nerves that come from the lumbosacral enlargement are going to be going to the lower limbs. So again, a lot of information going out, so that's motor information going out, and then a lot of sensory information coming back in from the lower limbs. We'd have a lot of information, a lot of cell bodies, a lot of myelinated axons. We need a larger surface area of the spinal cord, so we have an enlargement. It makes sense. So this is how you start to link structure and function together. Now let's have a look at a cross-sectional or transverse appearance of the spinal cord. And you can see up here in the top left, that is a freshly dissected spinal cord. Now what you may notice from here is we saw that in the brain, the grey matter was largely on the peripheral surface and the internal structure was largely white matter. However, in the spinal cord, this is reversed. In the spinal cord, the internal central structures are the grey matter. However, everything on the periphery is white matter. So in the next image I'm going to show you, what we've basically done is taken a very thin histological section of that. Now, please don't get confused here, because even though this internal area here is blue, this is actually representing the grey matter that you can see up here at the top left. We've just stained it so that it appears blue. And likewise, this area around the periphery is all white matter. So the first thing you can see in the center here is this beautiful, sorry, I'll just go back for a second, is this beautiful butterfly-shaped grey matter. And we're going to talk about how we actually subdivide that grey matter. But first of all, we need to talk about how do we determine anterior and posterior in the spinal cord. So, two ends, one of these is anterior and one of these is posterior. Now the easiest way to identify anterior from posterior is through this structure, the anterior median fissure. Let's break down these words and see why we call this. Okay, so we call it anterior because it's anterior, that makes sense. We call it median because if we were to split this down the center, then that is, as you remember, called the mid-sagittal or median plane. And a fissure is like a gap. So this is a wide gap in the median plane on the anterior side. Makes sense. Now this fissure, you can see it's quite wide here. It does thin out a little bit going towards the center of the spinal cord. But if you see this in situ, and unfortunately this isn't in situ, but you can still see the anterior median fissure here. It is quite wide indeed. So that's the first way to identify anterior. If you want to identify posterior, then you look at this. This is the posterior median sulcus, and the sulcus is quite simply just a little groove, and it's posterior and it's in the median plane. Excellent, good. Now in the center you can see this little space here, and we're going to call that the central canal. And in life the central canal is filled with a fluid. It's a hydrostatic fluid that gives buoyancy to the spinal cord, and we're going to call it the cerebrospinal fluid. Why? Because it's surrounding the cerebrum and surrounding the spinal cord. Hence cerebrospinal fluid, or CSF for short. Now on the periphery, what you can see here is all the white matter, and we said that a collection of axons in the central nervous system was going to be referred to as a tract. So the white matter that you can see here is going to be containing tens of tracts in the spinal cord, a lot of which we don't actually know what they do yet, but we just know they exist. But many of them we do know what they do. If you look in the center, as we said, we have this beautiful butterfly-shaped grey matter, and that grey matter can be subdivided into a dorsal or posterior component, and we call that the dorsal horn or posterior horn. Now the dorsal horn is mainly concerned with sensory things, okay? So I'm going to tell you just briefly that this group of axons that's coming in here towards the dorsal horn is going to be containing sensory information. And when it goes into the dorsal horn, it's going to synapse there. So the dorsal horn is going to contain sensory synapses, and it's also going to contain sensory neurons. Okay, remember that this is grey matter. So it's going to contain dendrites, synapses, and unmyelinated axons. Now let's contrast this to this anterior or ventral part of the grey matter. Now this is called the ventral horn. Why? Because it's ventral. Makes sense? Yes. And this is going to exclusively contain motor neurons. Do you remember we showed you those beautiful multipolar motor neurons? Well, the cell bodies for those multipolar motor neurons are going to be here in the ventral horn. And the axons from these motor neurons are going to be leading out from this little nerve here that you can see there. Okay? We'll be discussing more about this in the peripheral nervous system. Now, just for the sake of completeness, there is one more sulcus that you can use to orientate yourself, and it's called the posterolateral sulcus. Why? Because it's posterolateral. Posterior and lateral. Easy enough. And that's where these little nerves, and they're going to be called the dorsal rootlets, are going to enter into the spinal cord. So hopefully that gives you an idea of what a cross-section of the spinal cord looks like and what they actually do. Now let's talk about what the spinal cord is actually surrounded with, and they're called the meninges. We have meninges in the brain too, but we're just going to be concentrating on the spinal meninges for now. Now the outer layer is tough, and it's called the dura mater. Dura is tough, and so think about the words like durable, for instance. And mater means mother, so this is the tough mother of the spinal meninges. Now if we go deep to that, what you'll see is this sort of cobwebby connective tissue, and we're going to call that the arachnoid mater. So this is quite literally the spider mother. And the arachnoid is, as we said, looks like cobwebs, looks like spider webs, and it's going to be connected quite strongly to the dura mater. Now the innermost layer, which is in very close contact with the spinal cord, is called the pia mater. And that's, pia actually means tender. So this is the tender mother, because it's gently sort of cradling the spinal cord in its arms. Now we have a little space, and that's between the arachnoid mater and the pia mater, and that's going to be called the subarachnoid space. And we said that in the central canal there's cerebrospinal fluid. Well, here's another place that there's cerebrospinal fluid, in the subarachnoid space. Now something that you may not have previously known about the spinal cord, but hopefully you've picked up on it in the first slide, is that the spinal cord actually ends at L1, L2. And it ends in a sort of tapered cone shape, and we call that cone the conus medullaris. Now, caudal to that, we don't have spinal cord. What we have inferior to, or caudal to the conus medullaris is a group of nerve roots, and we call this the cauda equina, or horse's tail. So cauda means towards the tail, and equina is referring to equine, to horse. So this, when the first anatomists sort of opened up this area, then they thought it looks a bit like a horse's tail, and they called it the cauda equina. Makes sense. Now, one of the reasons we need to know this information is for procedures like epidural anesthesia, for instance. And so this is when we take a syringe, and it could be full of anesthetic. Sometimes they do epidural steroid injections, for instance. And I'm going to tell you that with epidural anesthesia, they tend to perform it inferior to the L1-2 vertebral levels. Now, think about that for a second. Okay, so the spinal cord ends at L1-2, and they do it inferior to L1-2. And the reason is, and I'm sure you've already figured this out because you're a bright group of people, is that if we do an epidural injection, actually what I'll do for the minute is I'll just orientate you to what you can see here, because I'm aware that you might not have seen this before. So this area here is the conus medullaris, which means we're about L1-2, okay, the very distal tip of the spinal cord. Where we want to place our epidural is in here, in the epidural space, and it's filled with adipose tissue, the epidural fat. And so if we inject our epidural here, and this is a correct injection because it goes into the epidural space, even if we manage to penetrate the dura here, we're going to go into these nerve roots that you can see here, but we're probably not going to go into the conus medullaris or any of the other spinal cord. Why? Because at this level of the spinal cord, of the spinal column, I should say, the spinal cord occupies very little of the foramen that you can see here, of the spinal canal. And if we go down to, let's say, L4, L5, L5S1, then there'll be no spinal cord. So all we'll do is we may injure a few nerve roots, which is not ideal, but it's certainly less threatening than direct spinal cord trauma. And you'll see a lot of these, and they normally use a thing called fluoroscopy to actually guide these. So what you can see in the bottom right is, here's the needle, advancing past the bone of the vertebra that you can see here. And that's all we've done here. Here's the needle advancing past the bone here. Now note that you can't see the dura and the nerve roots and the conus medullaris on X-ray. And this is why you need to know your anatomy, because the epidural needs to sit in the epidural space. And a person who is well versed in reading fluoroscopy images can tell when they're in the epidural space, even though they can't directly visualize the fat, the dura, or the nerve roots. Now, compare this to, let's say we did an epidural in a region, this is the thoracic region, but it's a region where you can see that there is clearly spinal cord here. Now, let's say that we botch it a little bit. Let's say that we go right through the epidural fat, through the dura, and we actually physically traumatize the spinal cord. Well, that is far more deleterious to our nervous system than if we were to just go through a couple of nerve roots. And this is why an epidural is anatomically safer caudal to L1 than superior to L1. Right, so there you have it again. Luckily, epidurals are a very, very safe procedure with few complications reported. Anyway, let's move on. So the question, I'm sure you're thinking, granted that this is of course your profession, is can we see central nervous system structures on imaging? And the answer is, well, it depends on what you want to see and depends on what type of medical imaging you're using. But generally, yes, we can see most central nervous system structures on MR imaging. We can see a lot of them on CT imaging, and there's some special techniques that we can use with X-ray imaging to view the central nervous system, but that's largely been redundant now that we've got CT and MRI. And so you can see here that the cerebrospinal fluid is perfectly visible. You can see the internal grey matter, which on this MRI is of course not grey, confusingly not grey, and you can see the peripheral white matter there, and that's taken as a cross-section through the spinal cord. And here, this is a really nice MRI image, and you can again see the spinal cord here as that thick, dark structure. Now notice that this thick, dark structure ends about there. And I hope you're thinking at the moment, well, I know why it ends there. It's because the spinal cord ends at about L1-2, and you'll be right. So let's actually just put this to the test. So here's L5, 4, 3, 2, 1. Beautiful. Okay, so there's our spinal cord. And here you can see some long strands of nerve roots, and that's going to be our cauda equina. So when you get into taking all these images, you'll be well versed in the anatomy, but it will just take a little bit of time to come to grips with it. So thank you for joining in, and next up, join us for the anatomy of the peripheral nervous system. Thank you.